Let's begin with our lecture, and today's lecture of infectious medicine is histoplasmosis. Histoplasmosis is the infection caused by the fungus, and it is mainly the infection of the lungs. It involves the lungs in about 90% of the cases, because the infection which is caused by that cause histoplasmosis, the causative agent is in the form of the spores. These spores are present in the droppings of the birds and bat, and these droppings of the birds and bat which are present in the environment, in the soil, sand, dust. So whenever there is cleaning done, the spores which are present in the dirt, and even during the demolition process, when there is so much dust and different sandy material, these spores can spread in the environment, and then it's really very easy to inhale these spores, and after the inhalation of these spores, these reaches the lungs. So the pulmonary histoplasmosis acute form is common in 90% of the cases. The histoplasmosis cause acute pulmonary disease, and this acute pulmonary disease is usually asymptomatic because of the activation of cell-mediated immune response, and this initiation of cell-mediated immune response fight the spores, fight the fungus, and prevent the disease. But once the immune system is weak, so as in immunosuppressed individuals, the infection becomes very common, and it is even fatal. So patients with suppressive disorders or illnesses like AIDS, patients with AIDS, they have very commonly, they develop histoplasmosis. So first, the inhalation of the spores in the which is in the bird and bat droppings. After the inhalation, these spores reach the lungs, and then from the lungs it goes to the regional lymph nodes or lymphatic circulation, and then to the blood, and then it can spread to different parts of the body. The organs which are commonly affected by the histoplasmosis, the disseminated form of histoplasmosis, we have the cutaneous lesions, we have the involvement of the eye causing lesions like chorioretinitis. In the GI tract, it involves the terminal ileum, and it affects the colon in about half of the patients, and it presents with nausea, vomiting, diarrhea, abdominal pain, bleeding. All these can occur with the involvement of the colon or the small intestine. And then in the skin cutaneous histoplasmosis, we have ulcers, papules, macules, pustules. All these different form of lesions can develop as a result of histoplasmosis. So histoplasmosis commonly caused by Histoplasma capsulatum, which is a dysmorphic saprophytic infection, mycelial infection. It's in the form of mycelia or threads, and once it is inhaled, spores are inhaled, they become yeast, and which is a vegetative form of the histoplasma, and this yeast vegetative form is capable of multiplying or reproducing and causing infection. So that's the mechanism how this histoplasmosis develop and how it affects the different organs. Next, the causative agent, as I mentioned, is the histoplasma capsulatum, and that's the histological microscopic appearance, and this is the silver staining done, and it shows the presence of histoplasma capsulatum. These are all with the silver stain. And histoplasma capsulatum, it is present in the environment in the form of mycelia, which are the thread-like meshwork or network myceliated organism. It is it turns into the it forms the spores which are inhaled, and then it becomes the yeast, and then the cellular immunity of the person, it becomes activated and then tries to fight the infection, and usually it prevents the disease from occurring. But patients who have weak immunity, in which their cellular immunity is not strong enough, they develop disseminated or more serious type of infection which can be fatal. So and then usually there is a dormant form of histoplasmosis also, and once the immune system of the person becomes weak, it becomes active again, and it causes histoplasmosis. Pathogenesis, again, as we talked, it begins with the inhalation of the histoplasma spores. These are the spores. Once the spores which are present in the droppings of the birds and bats, and it is present usually in the litter, and once during the cleaning, the spores, once they spread and they are inhaled, reaches the lungs. So after inhalation, the spores reach the lungs, and then from the lungs, next is it reaches to the regional local lymph nodes, lymphatic circulation, and from the lymphatic circulation it reaches the blood, and then through the blood it becomes disseminated and it reaches to the different organs of the body or different parts of the body. So by the inhalation of the spores, after inhalation, the spores reaches the lungs. In the process, they form the yeast, become the yeast, reaches the regional lymphatic circulation, regional lymph nodes, then also it reaches the blood circulation, and then with the blood flow, it reaches to the different parts of the body. The pathology, how the disease, as I already mentioned a little bit, here you can see these are the these are the form which are inhaled, and you can see the budding form of mycelia also. These are thread-like filamental structures, and we have microgonia and macrogonia. So these are the microgonias, and they are attached to the threads, mycelia, and you can see the budding forms or reproductive forms of the fungus also. So it appears as a microgonia, and here also you can see these are the intracellular fungus, and then we have in spores, and you can see the budding forms of the spores also. So after the inhalation of the spores, these are the spores, they enter the lungs, form the yeast, reaches the lymphatic tissue, and it also reaches the bloodstream. Through the bloodstream reaches different parts of the body, and it is attacked by the cellular immune system. And in the lungs we have pulmonary macrophages, we have histiocytes, neutrophils, eosinophils. and lymphocytes. All these cells, they try to destroy the yeast or the fungus that enters the body, to destroy it, so we cannot have the disease. So all these are the microgonia, and then we have the spores, intracellular spores, and you can see the budding form of the spores also. It is attached. We have the dermal infiltrate. There is dermal infiltration of macrophages, lymphocytes, histiocytes, neutrophils, eosinophils. As with any infection, we know the immune system of the body, which has all these different cells involved that becomes activated. There is infiltration of these cells in the area where we have microorganism excess, so they fight those organisms and try to protect the humans against the infection. So same is happening here, the activation of the immune system and try to bring it down. It can be acute. In the acute pulmonary infection, usually it is asymptomatic, but once it involves different organs of the body, in the skin, it can cause cutaneous infections, it can cause the ulcers, it can cause nodules, it can cause papules, pustules, vesicles, all these lesions of the skin. Then it can cause hepatomegaly, it can cause splenomegaly. Then we have lymphoid hyperplasia can occur. And then once the GI tract is involved, it can involve the terminal ileum, or in half of the cases, it can affect the colon. And when the GI tract is affected, then we have all the features like nausea, vomiting, pain, bleeding can occur, all these complications as a result of gastrointestinal involvement. So disseminated form of histoplasmosis is also present. All these are different pathological changes that are associated with histoplasmosis. So the other slide that shows the pathology of histoplasmosis. Again, we have intracellular. You can see the presence of fungus inside the cells. Intracellular fungi are present. There is with the nucleus, and all these are usually after the invasion of the spores or the fungi. They cause the activation of all the cells like neutrophils, macrophages, lymphocytes, and these try to entrap the spores or the fungus, and they are, you can very easily see, they are trapped inside so it's the intracellular presence of the fungi. Next, what are some clinical manifestations of the histoplasmosis? We have general manifestations. As with any infection, the general manifestations usually they are common to different infections. They present with the similar signs and symptoms. So first there is flu-like illness. Flu-like illness, they have a runny nose, sneezing, watery eyes. All these are present in histoplasmosis also. So there is flu-like illness. The incubation period of histoplasmosis, we can say, is from 12 to 14. So about 7 to 14 days. So the time from the start of the infection infection or invasion of the spores to the appearance of the symptoms. That's roughly the incubation period of histoplasmosis. So they have flu-like illness. Then patient will present with fever. All the infections usually have the fever. Some have high-grade fever, some have low-grade or moderate temperature. But the fever is the feature, or we can say the characteristic feature of all the infections which are present in the body. So flu-like illness, then they have the fever. Another general manifestation is the chills. Patients have chills, they have fever, we can say fever with the chills. The sweats are also one of the general manifestation of the histoplasmosis. Headache is also present, and there is anorexia, loss of appetite, and myalgia. There are body aches, pains, all that is present. This is basically the patient doesn't feel very good. They have a feeling they are not in a comfortable position. So they have myalgia, fever, sweats, headaches. All these are the general presentation of histoplasmosis. And as you can see in this picture, this is lesion is also present on the upper part of the lip, upper lip, and this is also the lesion of cutaneous lesion of histoplasmosis. There is also cough, shortness of breath, and chest pain. We already mentioned that the lungs are the mainly organ of involvement. In 90% of acute infection, lungs are involved, but this is usually the infection which is not very symptomatic, it's asymptomatic, or there might be mild symptoms present. But once it becomes chronic pulmonary involvement or chronic histoplasmosis, cause more serious manifestations, like there is chest pain because of involvement of the chest. And one very common complication we will discuss later on caused by histoplasmosis is the fibrosing mediastinitis, or mediastinum is involved. Mediastinum is the structure in between the lungs which contain the heart and the great vessels. And when there is fibrosis of that mediastinum, there is stiffening or the tightening of mediastinum. All these can cause shortness of breath and difficulty in breathing, and chest pain is also present. And there also it can cause pneumonitis and pneumonia, pericardial effusion. So once the complications of histoplasmosis occur as a result of weak immune system, or if there is a patient who is immunosuppressed or or a patient who is has disease like AIDS, or they are taking some medicines which can lower the immune system. So all these can cause serious fatal infections of histoplasmosis. Next, the chest radiograph, how the chest x-ray of the person looks like with histoplasmosis. That's the appearance. You can see the nodular appearance, and that's the x-ray of the patient with the histoplasmosis. Resembles the x-ray of a patient who has tuberculosis to some extent. So there is congestion, and there is nodularity and nodular appearance. Next, some manifestations of the histoplasmosis, and these are the rheumatological symptoms. Rheumatological symptoms are the symptoms when they involve the joints or the bones. What occur? There is arthralgia or arthritis, pain in the joints or inflammation of the joints. You can see there is redness, there is swelling, very, very painful condition. So once the infection becomes disseminated histoplasmosis, it can spread to different organs, and bones and joints is one of them, through the bloodstream, and it's a very painful condition. There is swelling of the joints and there is pain in the joints. There is especially early in the morning when the patient wakes up, these symptoms are more severe. The pain is more in the morning. As the days go by, it becomes better. Erythema nodosum. Erythema nodosum, again, that's one of the cutaneous manifestation of histoplasmosis. Erythema nodosum and erythema multiforme, and you can see that's the appearance of erythema nodosum. Erythema is the reddening of the skin, erythema. So this is erythema nodosum. Pericarditis. Pericarditis is inflammation of the pericardium. Pericardium is the lining of the heart or the covering of the heart. Pericardium has two layers. We have a visceral layer, visceral pericardium, and the so we have parietal pericardium and the visceral pericardium. Visceral pericardium is the pericardium that closes the heart inside, and as a result of this pericarditis, there is fluid formation inside the pericardium, and we have the more fluid. It can cause the compression of the heart or cardiac tamponade, and this is again, it prevents the heart from functioning or contracting properly, and it is again one very, very serious complication, and it has serious manifestations associated with pericarditis. Then we have the hilar. You can see the hilar or mediastinal lymph node necrosis. The infection, it reaches the regional lymph node, cause lymphoid hyperplasia, and then also it can cause the necrosis or the death. Necrosis is the death. You can see the appearance of the lymph nodes, and it can cause the hilar and mediastinal lymph node necrosis. So these are some, we can say, the serious manifestations of the histoplasmosis as compared to the general, which have fever, malaise, myalgias, headache. These are more serious complications or manifestations, including the arthritis, arthralgia, there is erythema nodosum, pericarditis, and there is necrosis of the lymph nodes. Next, what are some manifestations once the infection become chronic? What is the features associated with chronic infection? And the acute chronic infection becomes chronic because sometimes the causative agent becomes dormant in the body as a result of the immune system, and it is controlled by. But once the immune system becomes weak, the infection infection becomes active again, and it is present in the body for a long period of time. It's chronic now, and it has more serious implications. It can cause productive cough, dyspnea, low-grade fever, night sweats, and weight loss. So all these are the manifestations of chronic cases of the histoplasmosis infection. And this histoplasmosis, Histoplasma capsulatum, is it's in the endemic form. It's present in the endemic form in the regions of Mississippi River, Missouri, Ohio River Valley. So all these regions along the river valleys, it's endemic, and it's more prevalent in those regions of the all these are the Mississippi River, Ohio River. These are the rivers of the America, but it's present overall worldwide, and cases are reported worldwide also. So after the chronic manifestations of the chronic illness of histoplasmosis, now the next topic which we will discuss is progressive disseminated histoplasmosis. And this progressive disseminated histoplasmosis is once the infection reaches the bloodstream, and then it spreads to the different parts of the body. And it's important to know that this disseminated histoplasmosis usually occurs, or it affects the individual which have a poor immune response, or who are immunosuppressed, or who are immunocompromised, patients with AIDS or any malignancies, cancers, who are on chemotherapeutic drugs, or taking antibiotics for a long time, which have a low immunity. They can develop this disseminated histoplasmosis. And now not only the lungs are affected, because now it's the disseminated histoplasmosis, it involves the other organs of the body, like GI tract is very commonly affected. It involves the nervous system. It causes involvement of the skin, eyes, joints, bones, and then we have liver, spleen. All these different organs of the body are affected, and it's progressive. It keeps on progressing, and it is disseminated histoplasmosis. One by one, if we see different organs which are affected, it can cause neurological changes can occur, and even it can form the lesions in the brain. You can see the fungus in the intracellular fungi present on the pathological slides of the brain tissue, and it can cause lesions like neurological abnormalities, seizures can occur. So all these can occur as a result of the involvement of the nervous system. And then if we talk about the disseminated disease because of the poor immune system, now the lungs are also very badly affected in this condition, and it can cause like fibrosing mediastinitis can occur in disseminated infection, and it can cause involvement of the heart, and it can cause splenomegaly, and it can cause hepatomegaly is there, and then we have lymphoid hyperplasia, and there is necrosis of the lymphoid tissue can also occur. And then when we talk about the gastrointestinal tract, again, different areas of the GI tract can be involved in this infection, but mainly it involves in disseminated infection the terminal portion of the ileum, which is the part of the small intestine, which is we have duodenum, jejunum, ileum, and the terminal part is involved. It also affects the colon, and it can cause symptoms like nausea. We have vomiting, then diarrhea, bleeding can also occur, and then there is abdominal pain is very prominent in this condition also. Then if we go to the cutaneous histoplasmosis, in this picture also you can see the rash can occur, and this is only present in the disseminated histoplasmosis. If this is not disseminated, usually the cutaneous involvement is not present. So this rash, and in the cutaneous histoplasmosis you will see all different lesions like ulcers, we have nodules, vesicles, pustules. So this is the cutaneous involvement of histoplasmosis. Then if we talk about the involvement of the eyes in the disseminated histoplasmosis, it can cause chorioretinitis, and there is involvement of the retina, and there is inflammation of the choroid and retina. It can cause also the arthralgia. It can cause arthritis. Pericarditis can also occur as a result of disseminated infection. And pericarditis, after the development of pericarditis, which is inflammation of the pericardium. One very common complication as a result of pericarditis that it develops the fluid which is present, pericardial fluid, it becomes increased in number, and it can cause pericardial effusion, and this pericardial effusion cause compression on the heart, and it can cause different complications like heart failure and poor pumping of the heart. So these are all the features associated with disseminated histoplasmosis, and after the inhalation of the spores by that enters the lungs, it goes to the lymphatic circulation and then to the bloodstream, and then only disseminated infection occurs, or disseminated histoplasmosis occurs once the infection reaches the bloodstream, and then as the blood flows to different parts of the body, and then patient is also immunocompromised or immunosuppressed, so they have poor ability to fight against the infection, because the fight of the cells which fight the infection like neutrophils, macrophages, lymphocytes, all these are part of the immune system, and when the immune system is poor, they are not capable of fighting against the infection, and there is spread of infection and becomes disseminated. Also, there's the X-ray. We can say that once there is involvement of the mediastinum as a result of disseminated infection, also you can see the lungs are very badly affected. In this case, it's all congested, and there is lesions, and there is cavitary involvement of the lungs also. So once this disseminated phase occur and it cause involvement of the heart, there is poor contraction, pumping of the heart, there is more compression on the lungs also, and it can cause features like dyspnea. Then there is pain in the chest is very common after this, and there is also pressure on the great vessels like superior vena cava and pulmonary vessels, which are also the part of the mediastinum. So disseminated histoplasmosis is a progressive illness, and it's one of the serious form of histoplasmosis, and it can be fatal and even can cause associated with high mortality rate. Next, fibrosing mediastinitis can also occur as a result of the progressive disseminated histoplasmosis. And fibrosing mediastinum, as I mentioned, is the structure in between the lungs. It's the area in the lungs where we have heart and the great vessels. And when there is fibrosing mediastinitis, there is inflammation of the mediastinum, there is fibrosis of the mediastinum, and this causes shrinking of the mediastinum. That's the mediastinum, and there is shrinking, and as a result of the shrinking, there is pressure on the heart, there is pressure on the great vessels, and it can cause complications like shortness of breath. It can even cause heart failure, problem in the pumping of the heart. And once there is heart pumping abnormalities, it can put pressure on the lungs, and ultimately it can cause cor pulmonale because of the involvement of both the heart and the lungs. Again, these are the pictures of the scans showing the fibrosing mediastinitis. Manifestations of fibrosing mediastinitis, superior vena cava syndrome. Since the mediastinum also has the great blood vessels, it has the heart, and superior vena cava is the vein, largest vein in the body that brings the blood from the upper part of the body. It drains the neck and the head, all that upper part. And inferior vena cava drains the in lower part of the body. So the superior vena cava syndrome is due to the involvement of the superior vena cava that is draining the blood from the upper part of the body, and it opens into the right atrium. Then obstruction of the pulmonary vessels. Again, pulmonary vessels, it becomes obstructed because of the fibrosis and the obstruction of the pulmonary vessels. If we see in a broader spectrum, all these effects are affecting the circulation of the body, and once the circulation is affected, there is hypoxia, there is ischemia, decreased supply of blood, decreased supply of oxygen to different parts of the body, and slowly there are necrotic changes occurring, and there is death of the different parts of the body. And again, it's very, very serious manifestation of the histoplasmosis. Airway obstruction again can also occur because of the pressure on the lungs or involvement of the lungs. Recurrent pneumonia can also occur. Hemoptysis, blood in the sputum. Because of the pressure on the lungs and obstruction, there is blood in the sputum. When the patient coughs and there is productive cough, usually you see blood in the sputum also. And all these can cause respiratory failure at the end. Next, the diagnosis, how we diagnose histoplasmosis. The fungal culture of the fungus is performed, and if the fungus is cultured and it's histoplasma, that's the specific diagnosis, or we can say the definitive diagnosis that this is the infection caused by the Histoplasma capsulatum. So that's the fungal culture showing the petri dish, and you can see the growth of the fungus. Then cytopathology or biopsy can also be performed, examination of the cells or biopsy. And serologic tests done on the serum, they are also helpful in the diagnosis of the histoplasmosis. Treatment of the histoplasmosis, acute pulmonary. The acute pulmonary symptoms of histoplasmosis, they are treated by lipid amphotericin B. Amphotericin B is very, very effective against the fungal infections. So amphotericin B 3 to 5 milligram per kilogram per day, and also glucocorticoid, which is a steroid, for 1 to 2 weeks. Itraconazole 200 milligram twice a day for 12 weeks. Monitor renal and hepatic function. With these medicine, we should monitor hepatic and renal function. Next, the treatment of chronic and cavitary pulmonary disease. Again, itraconazole 200 milligram QD or twice a day for at least 12 months. So it's a long treatment, 12 months. Monitor hepatic function. For progressive disseminated type of histoplasmosis, again lipid amphotericin B 3 to 5 milligram per kilogram per day for 1 to 2 weeks. And itraconazole 200 milligram twice a day for at least 12 months. So it's a long treatment. With itraconazole, we give it's about 12 months of treatment. So histoplasmosis, if you see, is if it is treated on time, or if it is attacked by the cellular immunity or cell-mediated immunity, it can be cured, or it may lead to it's just acute condition, or maybe have few minor symptoms and no complications associated with, caused by the dysphoric saprophytic fungi known as Histoplasma capsulatum. This Histoplasma capsulatum, it is mostly present in the valleys along the river. So river valley of Mississippi, Missouri, and Ohio, which are the valleys of the America. It's very common in that region, but some cases are also reported worldwide and is present worldwide. Usually caused by the bird and bat droppings. So these spores are present in the droppings of the birds and bats. Once inhaled, reaches the lungs. From the lungs, it goes to the lymph node, goes to the blood, and as the blood flows to different parts, it can involve different organs of the body. It can involve the skin, liver, it can involve the spleen, lymph nodes, and it can involve the eyes, gastrointestinal tract, and then the joints, bones are also affected by this. Mediastinum is affected. So different organs are affected once the infection becomes disseminated, and it is a fatal infection once it becomes disseminated. Monitor again hepatic and renal function. So with the antifungal drugs, which is mainly amphotericin B and itraconazole, we should monitor hepatic and renal function. Next, the treatment of central nervous system infection, liposomal amphotericin B 5 milligram per kilogram per day for 4 to 6 weeks. And again, itraconazole 200 milligram BID or TID for at least 12 months. Monitor renal and hepatic function. It's very important. Keep on doing the hepatic and renal function test and liver function test while you are on this treatment. Thanks for watching sqadia.com.